Good evening, everyone. We are going to call to order the Special Committee on Long-Term Health Care. And Madam Clerk, can you please call the roll? Today, April 3rd. I'm sorry.
Chair Middlebrook.
Present.
Alderwoman Davis. Alderwoman Boyd. Alderwoman Ingracia.
Present. Oh, I'm at an alderman.
I got you. Miss Ingracia, I'm sorry. Present. Reverend Anthony.
Present.
Miss Holmes.
Present.
Mr. Braswell.
Present.
Mr. Jones. Miss Moore.
Present.
Miss Barrett.
Present.
Miss Richardson.
Sorry. Present.
Oh. I'm sorry, who said present? Was that Miss Richardson?
Lavetta Richardson.
Okay, I got you. Miss Awuri.
And Worry, present.
And Worry, okay. Mr. Lackey.
Andrew Lackey, present.
Miss Stouffer.
Present.
Miss Spraley. Miss Bachel. Miss Johnson. Miss Opsel.
Present.
Miss Jackson.
Present.
Miss Usher. Alderwoman Davis. Alderwoman Boyd. Mr. Jones. Miss Bachel. Miss Johnson. Miss Usher. I have a total of 14 present. You have a quorum.
Thank you. Okay, hopefully everyone has had a chance to go over the minutes. So can we get a motion to approve the minutes of the Monday, March 27, 2023 committee meeting?
So moved.
Second.
I'm sorry, who moved? I'm sorry.
Reverend Anthony.
Thank you.
Thank you. Okay, so now we will start our committee discussion. Item number 1 is the committee will continue its discussion about long-term healthcare and the state of long-term healthcare field, its non-for-profit and for-profit providers, its regulators, its recipients and their demographics, rate of pay, staffing pipeline, systematic problems, and possible solutions. Today, we have Mr. Andrew Wang, who is going to present for us.
Yep, hi.
Okay, and Madam Clerk, can you please swear in Mr. Wang?
Mr. Wayne, do you swear to tell the truth, the whole truth, and nothing but the truth?
Yep.
Thank you.
Thank you so much, Mr. Wayne. Very nice to have you here.
Thank you. Should I just go ahead or?
Yes, you can go
Sure.
ahead.
Good. Great. Can you guys see my screen? Great.
Yes, we can. Thank you.
Thank you. Hi, everyone. My name is Xichun Wang, and I go by Andrew. I work as a postdoctoral researcher at the University of Kansas. Today, I'm sharing some slides with the geographical examination of St. Louis long-term care facilities landscape. I am fortunate to have Professor Braswell as the academic anchor overseeing this research project and bridging me to this sharing today. Before I get into the following slides, I would like to acknowledge that the opportunity would not be possible without Dr. Ian Trivers at WashU for his introduction. The purpose of the presentation is to map out the spatial inequality of hospice care and long-term care nursing home in St. Louis with socioeconomic factors. The exercise aims to uncover new knowledge with special consideration. And all the data sets were collected from different institutions, as you can see on this table. This exercise conducted special analysis with census tract as the analytical units for consistency. With the sets of the data resources, the following results cover mostly cross-sectional analysis, with some we will expect further for longitudinal examination. Based on the data from the Missouri Department of Health and Senior Services, the long-term care facility can be categorized into four types here, including assisted living facility, intermediate care facility, residential care facility, and skilled nursing facility. The map will be the foundation for the next few slides that overlap with different special features. And I would like to draw your attention to the distribution of ALF, the red dots here, with most of them outside of the city into the west, and the SNF, which doesn't go to the west, which is the black dots here. Here, the skilled nursing facility, which account for most of the facility in the LTCF, is a specific category that often involve Medicare and Medicaid funds. We will take a closer look at this category later. The first mapping result, look at the racial distribution. Each small orange dot here means about 1,000 white people, with the small blue dots means 1,000 Black people. The denser the dots, the higher the population density in the tracts. The map reflected the historical legacy of Delmar Loop here. Of notice that the map reflected also the divided is not just between the races, but also the distribution of different facility. It indicates that, it indicates that the higher the SNF with the community of color and the higher ALF with the community of white. This ALF, the red dots, also concentrates on area of lower poverty challenges. The map shows that the prevalence of poverty among the tracts, the darker the color, the more residents falls under the poverty line. We see that there are fewer ALF sits under these darker tracts, whereas most SNF sits closest to the darker tracts. The housing cost is an excellent dimensions to look into this further for the daily expensive. The tracks here shows the prevalence of the renter having the higher housing cost burdens their monthly income. For example, suppose we pick one of this kind of light blue color, which state is kind of below 15, like this. And then it indicates that less than 15 of the household, they have the housing cost more than 30% on their monthly household income. What was interesting here is that the LTCF tend to locate it at adjacent tracts with the higher housing cost burden. That means like the lighter the tracts, the fewer the LTCF facilities. We look at household expenses also through the lens of food. This map highlights the area of lower income and low food accessibility. Here, the food accessibility is measured based on the consideration of the distance between the household and the groceries. It shows that most of the ALF do not face food accessibility challenges, where the denser SNF and RCF falling into this kind of a polygon color. From the cross-sectional standing point, it is quite clear that the ALF and SNF are distinctively distributed between the tracts of the better off and the deprived. Suppose that the socioeconomic factors doesn't change dramatically. How will the LTCF change over the period of the time actually? So at a higher level examinations, we found that the total facilities and bed have not changed dramatically over COVID. It has been steady about 190 facilities and about 20,000 beds within the city and county. But how about the underlying dynamic? We took a closer look at the SNF. Based upon the ways of operations, we can divide the facilities into the for-profit and non-for-profit. The for-profit one will be the orange dots here. The non-for-profit with the gray one. So with the poverty map as a preference, after we move out all the other LTCF, we could see a closer spatial relationship between the for-profit SNF with the tracts that having higher poverty rates. The finding kind of reflects the background knowledge that certain for-profit SNF with the funds from Medicare and Medicaid tend to recruit their residents from the low-income communities of color. It leads us to the last slides here to share that knowing that the SNF ownership changed lately. So we were able to identify about 14 SNF, which has changed hands since 2016. All of them are for-profit facility. Also, more than half of them are adjacent to area having a higher poverty rate. And so finally, I want to just address again that all these findings are based on the secondary data that we can draw on hand. And I believe that there are much more to learn, starting from these 9 identified facilities to dive in, knowing how the residence has changed since the change of ownership. And that will be a brief introduction of here, and I'm happy to answer any question.
Okay, thank you. That was a great presentation. If anyone has any questions, please raise your hand and I can call on you. Mr. Braswell.
Hey, everyone. Well, first and foremost, thanks, Andrew. That was awesome, actually. And you know, I encourage anybody to ask questions. You know, Andrew, you may need to share your slides again just to maybe go on some of the finer points of the map. But I wanted to give a little bit of the context for why I asked Andrew to do this. And also some of the story, you know, maps are powerful storytelling mechanisms, and these images are powerful. And so I am curious in general if we could include images in the report in some way. You know, so for example, a map like this, you know, it tells us a story about, okay, you could see the blue dots. I'm pointed at the screen. I don't know why I'm pointing at the screen. You can't see me pointing at the screen, but I'm pointing at the blue dots there in the kind of North City. I think it's around the Central West End area. Is that correct, Andrew? And that's yeah, a concentration of skilled nursing facilities versus you see the assisted living facilities in the county in much whiter neighborhoods, basically, for the most part. And, you know, I mean, I think that this was reflected to some extent in the SEIU documents that we read. And it's also a guy I'd like to come in and have to talk to us, which is David Barton Smith, which is the story of the overlap of nursing home care and racial discrimination in America. And I do think this is something we've been talking about, but it does seem, you know, Andrew, one of the last things you said in our last conversation, Andrew, is that the maps are a starting point. We would have to do more research to really fill this out, but I do think it's a very suggestive starting point because there is a high spatial concentration of residential facilities that correlates with the for-profit aspect and does correlate with racial and economic disparities in our region, and it's visualized very powerfully here. So thank you, Andrew.
Thank you. I'm going to ask former Alderwoman Ingracia, can the maps be presented in the report? Because I'm not for sure about that.
Yeah, I would think that if there were pieces of this that we thought were important to include in the recommendations to the full board when we come back next session, that's certainly up to this group to make that decision. Is that helpful?
That is. Thank you so much. Laura, you had a question?
Yeah, thanks so much. I just want to say thank you for preparing this. This is like a really super helpful, you know, explanation of a lot of things that we've been saying in terms of the statistics and everything. So I really appreciate the visual. I think it really does communicate very, very well. I also was just really struck by the fact that 14, you know, skilled nursing facilities have changed hands since 2016, all of them in high poverty areas and all are for profit. So I think that is a super helpful, that slide, yes, is very helpful. And I think really is a very great explanation of what's been going on. We addressed a little bit of this or some of this was addressed in the front page article that was in the Post-Dispatch on Tuesday. I don't know if you saw it, Andrew.
No, not yet. I don't think I got a chance.
Okay. So it basically talked about the growth in mental illness and some of the facilities. And I think that that might be, and the fact that age is dropping and the number of folks with mental illness is rising, it might be great to use this mapping tool is better than the tool we used in our SEIU paper. So it might be super helpful to have that laid out as well. I can send that to you or send it to Professor Braswell. He can send it to you, but I think it was a really, really important article, and I think really also affirmed the work of this committee and all the wonderful people who are spending their time on this committee. So and then Lavetta had a letter to the editor in on Sunday as well. So go ahead, Andrew.
I do see that. Sorry, I was a little bit missed. I do see that was shared by Professor Braswell, which is a really nice kind of knowledge background in terms of why it brings me to the Medicare and Medicaid topic here. So as Braswell mentioned earlier, is like we do believe that there is much more to learn on the qualitative side of these 9 specific places to dive in further. But it's just in terms of we are using secondary data in the moment, but that will be much more to learn how the patient being changed, especially how does that reflect to the mental issue patient. So that's another direction really looking forward to know. Yeah.
Thank you for all this work.
And next is Marjorie.
Hi, Andrew. Thank you. This is really great stuff, and thank you, Harold, for bringing him along, because this is really awesome. I was also really interested to see the number of. I know we're really focusing in a lot on skilled nursing facilities in this, but I think something for us to also pay attention to on some degree is the number of residential care facilities that are in the high poverty areas. And for those of you that might not be familiar with like some of the intricacies of that, so the residential care facilities, and those are the blue ones, are places where folks that have sometimes mental health issues, sometimes substance abuse issues. Basically, these are folks who don't need a lot of oversight, but do need help with maybe taking their meds every day or something like that. Some of these folks even have jobs, but these are also usually high poverty residents as well. So the fact that these are also in those high poverty tracts, I think is really interesting. The thing that I'm kind of wondering about is I'm wondering, especially with those kind of 9 sold facilities or even all of our skilled, if we made a map, CMS star ratings, kind of help us understand like if the facilities that are in high poverty areas in our community or majority Black areas in our community, what are the quality of the levels of those facilities? And I have no idea, and I don't want to give you extra work, but I think that would be fascinating for us to learn.
Yeah, the quality of that, there will be something to dive in further, especially like the nurses, how many working hours that they've been devoted and how much they got paid, kind of the conversation. But it just takes some other times to dive into that dimension. But I think there would be some way we can collect some secondary data, because I know that the institution, like where we draw this information, sort of they have the regular yearly checking, that kind of stuff. So that will probably be where I can look in further to know, like adding one more layer of the attributes tied into these 9 facilities in terms of how they are reflecting on the quality of the provision of nursing care. I mean, that would be a potential dimension to look into.
I know that CMS collects a lot of that data, and
yeah.
Long-Term Care Community Coalition makes it usable too, which is very nice.
All right.
Thank you, Mr. Braswell.
Sorry, I just wanted to follow. So first of all, Marjorie, could you actually email me links to some of those data sources, and I could send to Andrew, like the CMS star ratings and things like that? Because I do think that you guys at Voice know a lot about this stuff that, you know, we don't know nearly as well. So that, I think that would be helpful. I just wanted, could you go back to the food map, Andrew?
Sure.
I just want to say, why I asked Andrew to make this map, just in terms of one thing that, so I've been working on a book about hospice and housing discrimination. So basically about how residential housing discrimination impacts access to hospice care and also the quality of hospice care. And so one of the things that has come up in thinking about that has been, you know, a question that we have is what happens so that people have to enter these facilities to begin with? What makes home care unsustainable for people who are mentally ill, for example, for people who need long-term care? And, you know, housing discrimination creates a lot of things that do this, but if you're in a food desert that you can't get food very easily, or your caregiver has to drive a very far distance to get you food or basic nutrients, it's going to be harder for you to get to stay at home. You might need to be institutionalized earlier in that event. And so that was sort of why I asked Andrew to make this map. And this is something just to kind of be thinking about, because we're trying to keep people out of these facilities. That's one of the things we're trying to do. And a lot goes into that from a lot of different areas that could allow people to stay at home for longer.
Thank you. Andrew, is it possible that you can send your presentation over to the clerk so everyone can get a copy of it?
Yeah, I can just send that to Professor Harrow, and then perhaps he can just share this with you. Yeah.
That would be great. Thank you. Does anyone else have any more questions? If so, you can just kind of start asking. I don't see any hands.
Yeah, I was going to say it might be even helpful to consider in the report something stating the difference between food deserts and poverty areas and areas outside of the city where there are other nursing homes, and how that impacts access people's care.
Yeah.
As food desert, food. That was the first thing I thought about when I saw the scale here on food accessibility. Are these facilities that are more local in places that are considered food deserts?
Yeah. So that's a great question. So the thing is really about the scope we are looking at too. Like especially right now we are just extracting the information based on the county boundary and city boundary in St. Louis, but it can be expanded to like East St. Louis. Like that's another portion, but potentially that's kind of beyond the boundary here. But heading west beyond the St. Louis County, that's also somewhere we can look into. But if that's part of interest, I can dive in further on that dimension actually. But we'll see if that's needed. Yeah.
Thank you. Does anyone else have any questions?
Hi, this is Cindy Jackson. I have a quick question. Thank you, Andrew, for your presentation. And I just wanted to go back to the mention about connecting some of these skilled nursing facilities and some of the communities that you showed with CMS star ratings. I think that's a great idea, and we need to always be looking at star ratings and quality. However, I do know that with the rapid changing of ownership and the delay in surveys, and that some of the star ratings currently may not be an accurate representation of the level of care that patients are actually receiving right now. So I think as we look at the star ratings or look at quality measures that CMS is reporting on, we need to also be mindful of the delays and also of if that star rating really is tied back to the current owner. So just a comment there.
Yeah, and that's a great question, great comments actually. So all the start here, I believe we can track it into from 2016, 17, 18, all the way to 2020, 2022 actually. So that means that we can plot them out by time of which facility. And so if that's the particular 9, like we want to know when do they change hand versus when's the star rating comes out, and then reflecting on that. That's another way to do that actually. So yeah, I can give it a try to kind of spreading out into time, and also, but if I need to know what's the times dimension from the star rating, that would be where I can match them together.
No,
yeah.
yeah, and that makes sense. And I'm not sure exactly, you know, if CMS has on like the compare sites, if they have like when the last survey was done, that would be helpful to know. But I know that some of the skilled nursing facilities report that they haven't had an updated survey for like 2 to 3 years. So that's, you know, somewhat of a concern.
Okay, thank you. Does anyone else have any comments or questions? Okay, seeing none, we want to thank you, Andrew, for coming in and giving us this excellent presentation. We really appreciate you. And at this time, you can go ahead and log off.
Sure.
Unless you have something else.
No, I'm good. Thanks again. And let me know with any questions, and you can find me through Hera actually, but he knows me. So thank you again. Good day.
Thank you. Okay, next we are going to, are there any other discussion that anyone has next week? I have reached out to the building division and I'm still waiting on a response for someone who can come and speak to us about how they inspect the different facilities. Is there anyone else who has any comments?
I just wanted to ask if it would be okay with the group. I had contacted a long time ago, but I didn't actually book him. A guy named David Barton Smith. He's a health policy scholar at, I think Temple, maybe a different school in Philadelphia. I'm not sure which, but he wrote a very major article on racial discrimination in long-term care facilities, sort of basically tracking how, for example, the racial composition of residential care facilities versus assisted living facilities has changed over time. And I thought he would be an interesting person to have speak to the committee, as that is something that's kind of come up over our work here. So I just wanted to ask, would it be okay, everyone, if I asked him to come on either the 17th or 24th?
I think that would be great.
Okay. Any preference on the 17th or 24th, or just whichever one works for him is fine?
Yes, whichever one works for him, that would be great.
Okay, I'll reach out to him. Thank you all.
Thank you, Laura.
Hi, we have Nathan Dell from Places for People scheduled for the next session on the 10th. So that's one person that has been scheduled. I think Marjorie was also going to present. Is that right, Marjorie? So maybe, you know, that will be a fantastic presentation, I'm sure. And then I also wanted to, we had one of our members just recently on a webinar with Consumer Voice, who is doing a deep dive into the new Biden rulings that have been put out on ownership transparency and staffing standards. So I think it would be helpful to have a representative from Consumer Voice if I can find one. So that I just wanted to give that quick report on speakers that we were looking at.
Okay, that'll be awesome. Thank you so much. Marjorie?
Yeah, so yeah, I'm also happy to present a little bit too, you know, from Voice's perspective, especially on really what facilities are actually supposed to be by law, is what I've kind of prepared. But I also did want to say that we still do have a resident who is of one of the facilities who's willing to speak to us. And I think that perspective of the folks that are actually living in these situations is really important for us to get. So whenever we've got some availability, I'd love to be able to bring him in, but kind of want to have which date might work best for that.
Okay, so Marjorie, will you be presenting next week on the 10th?
I sure can, yeah.
Okay, well, if you want to have the resident also come on the 10th, that would be great.
Okay. Perfect.
So that would then be 3 people on the 10th, yep. Nathan, Marjorie, and I think it was Theo Kleiss from Hillside, Marjorie?
Yeah.
Yes. Okay, well, I think we have a plan here. If there does anyone else have any more announcements?
I did. If I'm sorry, one more time. If I meant to circle back, I did my homework and rewatched last week's, and I missed. I know there were several questions about the ombudsman's connection with legal aid, and I don't know if now's a good time to talk about that, or if we want me to talk about that next week.
You can go ahead and talk about it.
Okay. So there, Nina's presentation was absolutely phenomenal. First, I was interested, and so after watching it, I spent some time talking to a couple of folks on my staff who do some of that direct ombudsman work, including Lisa, who you heard from, and really what I got was one of those things are different here in Missouri sorts of things. We do some work directly with legal aid, passing folks back and forth. However, because of the way the ombudsman program is set up here in Missouri, really what we're able to do is provide the information to a resident who might be looking for additional legal services. And that includes like not only legal services of Eastern Missouri, but also maybe some elder law attorneys if that's appropriate, and provide that information to them. But that's really as far as the ombudsman program in Missouri is allowed to go. You know, we have had conversations with folks from legal aid, things like that, but we really can't hold the resident's hand into that. One of the big challenges that we've seen, particularly with lawyers that are outside of that legal aid system, is very few of them, and I think Ellen may have mentioned something, very few are willing to touch any kind of nursing home sorts of lawsuits, partially because here in Missouri, the cap on monetary damages, I believe, is at $750,000, and that's for actual death. And so that's the most amount of money that they can collect, which seems to be a big problem. And I guess it costs lawyers much more to do their jobs than that. So, so the legal side of it is pretty messy. And so we're not getting as many lawsuits against the nursing home industry. And a lot of that is because of, as Nina mentioned, it's a very powerful lobby that's really set themselves up well.
Okay, does anybody have any comments or questions?
This is Andrew. I have a question for Marjorie. Did you have you know, I think there was talk about legal aid, but there was also talk about the legal clinics, the two legal clinics in associated with the law schools in town. Has Voice ever worked with the legal clinics, and is that a relationship that you had in the past?
We have not, but that is a relationship I'd love to pursue and see a little bit more about. So if anybody has connections to those, because from what I can tell, we don't have any connections there. So that would be great folks to get to meet.
Jamie?
That's great, Marjorie. I'm glad to hear that, because that's what was one of my questions from last week too, is those connections. And then the other question is for you is, do you know of other gold standard policies in other states that Missouri could look at through the governor's master plan on aging for long-term care? I know you're on that committee, but part of the state master plan on aging is to recommend potential policy changes. And so are you aware, or could we become more aware of maybe some gold standard policies that could help move us along so that there's more of a shift in the power?
Yeah, I think we've been kind of starting to poke around this a little bit at Voice, trying to go, okay, what are other states doing really well? And I know that Texas, of all places, actually has some really good policies around long-term care, from what it seems, from an ombudsman point of view. So that's been some information we've been collecting, but I don't have enough yet to say like, these are really great and these aren't. I think that would be something great to actually talk, the consumer voice people would actually be able to provide us with a lot of that.
Thank you, Harold.
So, Marjorie, I'm happy to put you in touch with Sydney Watson at the Department of Health Law Studies at SLU, who I would be the most logical person for me to put you in touch with, because she's like a Medicaid expert. She does long-term care stuff, and I don't actually work in or with the legal clinic at all, but she might be able to establish those conversations better. I'm also wondering if you'd want to get in touch with Nina. I'm happy to kind of put you two on an email thing, because maybe you could tell her a little bit more about the specificity of Missouri, I guess, in terms of this, and she might have some ideas as well.
Yeah, that would be fantastic. Thank you.
Jamie?
Sorry, I had a follow-up question. So in relation to what we heard about some of the nursing homes in the city with dealing with the raw sewage, bed bugs. So as an ombudsman, if they go into a facility and they find these things, are they mandated reporters where they can hotline that?
So that's complicated. Yes and no. So one interesting thing about the ombudsman program as a federal rule is the ombudsmen are not mandated reporters, even if in another line of work, like maybe if they're a social worker, they're a mandated reporter. So when they're serving in their ombudsman role, they are not mandated reporters, and that's because of confidentiality and all kinds of things that they baked into the program at the federal level. However, if they go into a facility and find something like that, they immediately start working on it with the facility. We actively encourage residents, families, and staff to hotline the facility. And if it is something where we think that it's not going to go anywhere, we do have a process for reporting it out. It just doesn't look like the mandated reporter process. We have to get several levels of permission in order to do that. So
is there any way to monitor, I'm curious, is the sewage issue cleaned up now? Like, how long does it take? Like, is anybody monitoring that?
Yeah, so we've been working on the issue at Hillside since last summer with the sewage issue. Is that about when it started, I think? And we've been, so the ombudsmen are mediators, but, so we're all carrot, no stick. So we've been working on that with the facility staff. We've reached out to different entities that we thought could help, made suggestions, things like that. Certainly called the surveyors multiple times. And I know that they've been in touch with the local folks about that. Even though it didn't sound like the top state folks knew about it. I know that the folks that are here in St. Louis know about it. And, trying to get things better for the residents. And so Lisa, who you guys met a while back, has been at Hillside probably monthly, when typically the staff person would only visit quarterly. But she's been at Hillside much more than that, trying to make sure residents are safe.
I'll reach out to the health department also, to the building division. I know some folks over there just to see, especially with Hillside, what the status of that is.
Yeah, I'm not sure where it is right now. I know there's been some improvements. I don't know if it's done though.
Christine?
Thank you, Alderwoman. Yeah, I'm glad you mentioned that, Annalise. I'm curious, Victoria, if you might have any insight. It sounds like obviously the building division has some oversight of some of these issues, but I would assume raw sewage and some of these other pieces might fall under the purview of the health department. Does that sound correct?
We have some community sanitation, authority, but I'm not sure exactly if it's raw sewage. I can look into that.
Yeah, Madam Chair, if it's okay with you, I think it might, if we're having the building division come, it might make sense to figure out who at the health department could kind of brief us on what the roles and responsibilities of that city agency would be in addressing some of these problems.
Absolutely. I will get in contact with them. Thank you.
Yeah, and I know we've all given you a lot to do. So if there's anything I can do to be supportive behind the scenes to get folks scheduled, please keep me posted. I'm still happy to do that.
Thank you. Does anyone else have a comment? You can jump in.
Just real quick, I have been in contact a little bit with Tracy Meekamp on the bed bugs and raw sewage issue. She came in and testified before this committee a couple of weeks ago. She also was able to share a little information about when their last inspections were, but I just, it's still an issue. We sent pictures that are, from the facility that are still a problem. There's other pests there in addition to bed bugs. It seems like the bed bugs are a little bit more under control, but there's mice and roaches. So that's still a problem. But I think that all of these efforts to figure out sort of like where the lines of responsibility lie, and then having some kind of flow chart as part of our final report would be super helpful, because then we can just direct people to the correct place. And so there's not a multiplicity of calls going in. And then also, I think just recommendations on how we can support the ombudsman program. Perhaps there's times when, you know, it'd be better to have another person report on something or something like that. But there needs to be ways that we're working together, and then also making sure that folks are being held accountable.
Thank you. Does anyone else have anything to add? Okay, if not, Tracy, can you call up the names of the people who are not here?
Yes, ma'am. Give me one moment.
Thank you.
I'm so sorry. I was in something else.
No problem.
Okay. I have Miss Usher, Miss Jackson, Alderwoman Davis, Alderwoman Boyd, and Mr. or Mrs. Bagel.
Tracy, this is Chris Beckley. I am on. Oh, Terry gave me his. He gave me his Zoom invite. Mine wasn't. I didn't get it, so I'm on.
Oh, okay. Well, then I have Alderwoman Davis, Alderwoman Boyd, Miss Jackson, Miss Usher.
Hi, this is Cindy. This is Cindy Jackson. I'm here.
Okay. Well, okay. I have Alderwoman Davis, Alderwoman Boyd, and Usher.
Okay, thank you.
Everyone else was in attendance.
Thank you. Okay, we would like to excuse those members for necessary absence, and we will adjourn until next week.